Maharashtra Health Minister Dr. Deepak Sawant has triggered a massive controversy with his statement that members of the LGBT community need psychological treatment. The state health minister's bizarre comment came on the floor of the House in response to a question by a BJP legislator on steps that were being taken by the government to stem the spreading of HIV among the LGBT community. The minister added that the government was working with NGOs in the sector to counsel members of the LGBT community. This, remember, isn't the first time that a state minister has made an appalling comment about the community. In January this year, the sports minister of Goa had said that the government would administer treatment to LGBT youth to make them normal, quote-unquote, again. All right, senior lawyers calling this comment unwarranted and uncalled for. Let's get in a word from our correspondent Kamlesh Sutar, who's with us live from Mumbai this afternoon. Kamlesh, we're seeing that the health minister of Maharashtra made this comment on the floor of the House. What was the reaction of other MLAs?
Let me update you. Simi just spoke to the health minister Deepak Sawant, who had made the statement yesterday, and just a while before he has denied of saying anything of that sort. He says that his comments are misinterpreted by the media. What he said, what his explanation was that he was speaking in terms of blood transfusion. The question in the House, which was raised in the question hour, was about blood transfusion and by allowing equal rights to the LGBT community to come forward and donate blood. And in that sense, he said these comments were made that counselling would be required for both the LGBT community, people who want to come forward and donate blood, and also to those who are skeptical about accepting blood from the LGBT community. So the minister, though, coming out with a clarification there, instead the MLA, BJP MLA Ashish Shelar, who made this, who had raised this question, also came in defense of the health minister, saying that these comments are misconstrued and the question he raised was totally different from what is being reported widely in media today. So at this point in time, they are making a huge U-turn on the statement, given the fact that these kind of statements have invited a wrath from activists and the social media in the past. But now the latest update is that the minister and the MLAs who raised these questions have done a U-turn on the statement and are completely in a denial mode.
All right, the Health Minister of Maharashtra, Deepak Sawant, now denying that he made this comment. Kamlesh, thanks so much for that. The Maharashtra Health Minister, Dr. Deepak Sawant, triggered a massive controversy for his statement that members of the LGBT community needed psychological treatment. The State Health Minister's comment came on the floor of the House reportedly in response to a question by a BJP legislator on steps that were being taken by the government to stem the spreading of HIV amongst the LGBT community. Now, Dr. Sawant has denied that he made these comments. He's saying he was being quoted out of context. The minister added that the government was working with NGOs in the community to counsel them. He claims that they're suffering from psychological disorders. This isn't the first time that a state minister has made a comment like this. In January this year, the sports minister of Goa had said that the government would administer treatment to LGBT youths to make them normal. Of course, the Maharashtra Health Minister now withdrawing his statement, saying his statement is being quoted out of context. He said he was talking about blood transfusions within the community, saying he did not say that members of the LGBT community were suffering from psychological disorders. The big story that's coming out of Maharashtra clearly shows that the mindset of a political class hasn't really changed, despite the fact that there have been a series of awareness drives and parades where members of the civil society have come out on the streets of almost all major metros and also of B-towns to show that members of the LGBT community are as normal as anyone else. They have a right to express themselves as well. But clearly now the statement from the Maharashtra Health Minister, a reflection of the kind of thought process that goes on amidst the kind of thought process that our netas endorse.
Definitely counseling की आवश्यकता है कि टेस्टिंग सेंटर्स हमारे पास है, काउंसलिंग सेंटर्स है, तो इसमें इसका फ़ायदा लेना चाहिए और टेस्टिंग करने के बाद ही किसी भी नतीजे पे आना चाहिए कि whether I am having HIV or I am not having HIV. इसके लिए कोई भी साइकोलॉजिकली हमारा खुद की फ्रेम क्रिएट नहीं होनी चाहिए और इनके लिए सिंपैथी है और ये सिंपैथी की वजह से हम लोग ये कहना चाहते हैं कि ऐसे सेंटर्स में जाके हम लोग ट्रीटमेंट लेनी चाहिए और ट्रीटमेंट के पार्ट ट्रीटमेंट किसी को भी HIV हो सकता है, इसमें यही रिस्पॉन्सिबल है, यही कम्युनिटी रिस्पॉन्सिबल है, ऐसा नहीं है। HIV के लिए हमारे जो सेंटर्स है, ART सेंटर्स है, उसमें टेस्टिंग होता है और ये टेस्टिंग करने के बाद ही किसी भी नतीजे पे इनके बारे में आना चाहिए।
जो पूरे मामले को लेकर जो खबर चली है कि उनकी ट्रेनिंग होनी चाहिए, काउंसलिंग होनी चाहिए, तो क्या आप स्टेटमेंट जो खबर चली उसको आप खंडन करते हैं? नहीं,
खंडन नहीं। काउंसलिंग का मतलब क्या होता है? काउंसलिंग का मतलब क्या होता है कि मुझे अगर कुछ हुआ है तो इसकी जांच मैंने करके लेनी चाहिए, ये इसका स्टेटमेंट का रुख है, तो इसको ट्विस्ट करने की कोई आवश्यकता नहीं है। See, regarding the certain group of the people which I have stated in the assembly, that statement was twisted, unfortunately, because I want to say that there should not be any psychological taboo. I should have the counseling proper, I should have the proper testing, then I should come to the conclusion that whether I am having HIV or I am not having HIV.
All right, that was Maharashtra Health Minister Dr. Deepak Sawant denying that he made any controversial statement. Of course, media reports allege that he had issued a statement on the floor of the House saying that members of the LGBT community need psychological treatment.